Hi and Assalamualaikum. I am Rakila Amira binti Muhammad Zainuddin.
My name is Shafizatika binti Shahrudin.
My name is Nur Izzati Zikri.
My name is Nur Izzah Irdina binti Amizul.
My name is Nurul Aizahira binti Saini.
Health are the most important things to take seriously in our life. The reason of this circumstance is to ensure the society will not in undesirable condition and the government can handle it with care. Hence, to ensure the health of society are not neglected, every country should have one Minister of Health to control the rate of health to not be in a critical position. The Minister of Health is one who get the second largest budget, which is RM32.4 billion, and another extra RM4 billion for agenda in dealing with COVID-19. The total amount is subject to three parts that have been given priority in 2022 budget, that namely for the well-being of people, a prosperous and sustainable economy, and a viable business go on. Therefore, from the total allocation given by the Ministry of Finance to the Ministry of Health has been used as best as possible. The mission of Ministry of Health is to fully attain their health potential, to appreciate health as a valuable asset, and to take positive action to further improve and sustain their health status. Next, the vision of health is Malaysia is to be a nation of health individuals, families and communities through a health system that is equitable, affordable, efficient, technologically appropriate, and environmentally adaptable and consumer friendly, with emphasis on quality, innovation, health promotion and respect for human dignity, and which promotes individual responsibility and community participation towards an enhanced quality of life. Next, to ensure people well-being in a good condition, the government should have a good strategy. So the strategy that can be used is to give a free vaccine to the society. During this pandemic COVID-19, the government should play a good role to ensure the society can have a good life and did not be burdened. So that the strategy that should be used by government is to provide the vaccine for free to everyone. The reason of this circumstance is because the price of vaccine is very expensive. So this is very unfair to the society who are unable to pay for the vaccine. Thus, this strategy also can help the society be more interested to take their vaccine and did not have too much reason to refuse the vaccine because it will be provided for free. This will also help the government achieve a zero coronavirus quickly because with vaccine, the pandemic can be controlled and did not give too much burden to many parties. The program that can be run is National COVID-19 Immunization Program, or can be known as PAD, which this program to provide a free vaccine to the society. This program had been implemented by the government in order to ensure the rate of coronavirus disease did not spread easily. The goals of this program are to ensure the national economy will be able to recover and life of the society will be improved. Next, the budget allocation for this program in 2022 budget is 4 billion, where 2 billion are for vaccine and the other 2 billion are for health facilities. So that the 2 billion allocation that had been provided can be used to buy the vaccine from other countries. The vaccine has a lot of type, but the effectiveness is same where it can avoid someone to get infectious easily. Moreover, another 2 billion allocation will be used to open the new place for health facilities. For an example, it can be used to rent the vaccination center to get their vaccine, or your hospital to have people who need to quarantine. Moreover, the method of distributing the vaccine is by giving priority to Malaysia citizens according to the age level and the frontliner from public and private sector, because they're the one who need to take a good care the patient who has been affected to the coronavirus disease. This program has been conducted using application MySejahtera, where all citizens must register their names to get the appointment. This application also has a lot of function where the citizen needs to scan a QR code before enter somewhere to track their history place. Thus, after they register in MySejahtera, they must alert to the date, time and place which has been set to get the vaccine. The reason why citizens cannot choose their own date, time and place is because to avoid any issue like too many people in one time and did not have any social distancing that can lead to the rate of virus to easy to spread. So the outcome of program National COVID-19 Immunization Program, it shows a lot of positive feedback because with this program, the contagion of the coronavirus shows a positive effect when the percentage of patients keep decrease from day to day. This shown that this program's success to help the society to continue everything without face a lot of misery such as need to lock down at home, did not have enough necessities and food, and they also can work without any fear. In addition, this program will give a good significance to the society and also to the government because if the society did not have a good health condition, many sectors cannot be running because no human labor. Furthermore, the program also can decrease the rate of death in Malaysia. The reason of this circumstance is because if someone get their vaccine, the infection and death rates will be lower compared to the someone who did not get the vaccine. Other than that, this program also can help the society get their treatment more quickly because there is enough space for the patient to get their space when they got affected. Hence, with the budget allocation that have been provided by the government, the Ministry of Health need to manage the program properly to ensure the society will get their right to have a good health and will not be burdened during the pandemic. In the other hand, if the society have a good health, this will also increase the country from any aspect like economy and social because they can work without any obstacle at once can increase the development. Okay, next, the second strategy is to increasing the economy to ensure the society can keep growth by using MyMedic program. Various types of programs have been organized by the government to develop the country economic sector. In addition to the COVID-19 pandemic where the economic sector has collapsed because of the effect of COVID-19. Therefore, the government that made an initiative to revive the economic sector by implementing the MyMedic program, which is one of the mobile vaccination program. In the budget 2022 given by the Minister of Finance of Malaysia, Tengku Zafrul Aziz, which state that the allocation for the MyMedic program was increased by 4 billion. Thus, with the budget allocation that have been provided, it can be used to get a transportation and more health necessities to run the program. The budget used for transportation is 3 billion, where it will be used to buy the transport such as van and ambulance, which can be used to move into areas of those who do not have transport to get their vaccine. In addition, another 1 billion will be used to buy health necessities such as needle, syringe, carton and support that related to the vaccine program. This program is given priority to areas far from the city center, residents who do not have the transport to go to the city, such as PPR housing area, where most of the residents there are a senior citizen. Hence, with the program, it will help the society to get their vaccine even though they did not have any convenience to go to the PPB. Okay, the outcome of MyMedic program is with the existence of the program, it can increase the income of the economic sector because when 90% of the community has received a complete vaccination, it can perform activities as usual by following the standard operating procedure SOP that have been set by government. For an example, for those who want to start a business such as a restaurant, the owner of the restaurant must be responsible for ensuring that each employee has received a complete vaccine so that it can protect themselves and others too. In addition, they can start operation as usual in accordance with the condition issued by the government and can generate their income and will not suffer due to the lack of wages. Next, it also can increase rural income. We can see that when the COVID-19 pandemic hit our country, the people who were most affected were from the rural population, that is those who live in remote areas and villages that far from the city. When COVID-19 took place, the movement of the rural population became limited because most of them were farmers who produced the first economic sector, which was agriculture, and what if they did not get a complete vaccination or the relevant parties did not care about them or not seeking for a solution to overcome the problem, then they cannot obtain a source of income as usual. Therefore, with the existence of this medic program, they can get vaccine injection faster and be able to carry out agricultural activities and become a major producer to wholesaler and retailer in the city. With that, they can increase their source of income because they have a high demand from wholesale as well as retailers. This shows that the vaccination program has a positive impact on the rural population like this for them to continue their life as usual even in the new norms.
So the second strategy is to ensure the mental health of the community is in good conditions. So mental health is a state of well-being in which an individual is aware of his or her ability and can cope with the stress of normal life, and also can work productively and is able to contribute to his or her community. Since the emergencies of the COVID-19 pandemic, it has a major impact on the mental health of every individual in Malaysia. Some individuals are at high risk for mental health problems, including depressions, especially when they are in a state of extreme stress. The people involved with this mental health issue are not only from the adult, but they are also from the teenagers and children. Mental health is an important element in determining the functions of the human self and affect the level of health and well-being. So, to ensure the well-being of Malaysians is always in a good conditions, the Ministry of Health Malaysia has implemented several initiatives through various programs. Okay, the first program is mental health awareness. This program aims to convey all the information that the people need to know to ensure the mental health of Malaysians can be formed well. This awareness program will also make the Malaysians more sensitive to what their job is as the closest persons to individuals with mental health problems. Through these programs, Ministry of Health in Malaysians will collaborate with Malaysians Medical Relief Society Mercy and also Jabatan Kemajuan Islam Malaysia JAKIM to provide awareness on mental health to the people through campaign in 14 states, where the people of every state will gain knowledge about the mental health. This mental health awareness campaign aims to provide people with information about the mental health, the early symptoms of the mental conditions, and how to overcome this mental health. This awareness campaign is not only urban areas, but the purpose of working with Mercy is to raise awareness about the mental health of the people in rural areas. A large amount of allocation is needed for this campaign because it covers all areas, whether urban or rural areas. Also, this mental health awareness program will be done in the form of advertisements and promotion through TV and radio stations. Ministry of Health in Malaysia choose Radio Television Malaysia RTM and Media Prima as a medium for advertisements because the majority of Malaysians was and have this channel. This also in line with the presence of the B40 group who may not subscribe to Astro. They will post awareness about the importance of being alert to mental health and what to do when experiencing symptoms of healthy problem and what we can do as individuals who have relationship with the individual with mental health problems on TV1, TV2, TV3 and so on. Talk sessions with psychologists will also be held during the promotions and advertisements. Various questions can be asked during the interview stations. The promotion and advertisements through mediums such as television channels and radio, so the pupil will be more sensitive and alert and aware of the mental health knowledge. This advertising will be promoted about the mental health every month. So, moreover, 30 million have been allocated to realize this mental health awareness program. 20 million is used for the mental health awareness campaigns and 10 million is allocated for the promotions and advertisements on mental health. The 20 millions will be used in collaborations with Mercy and JAKIM to organize awareness campaigns. The allocations will be divided for 14 states and therefore a total of 1.42 million for each state, and next a total 10 million to promote mental health awareness through advertising. The amount of 10 million will be divided by 12 months. This will make 1 month of 800,000 to promote mental health awareness. This is because this promotion will be done every month to ensure that the people are more alert and aware of their mental health level and sensitive to the efforts of the government and the Ministry of Health measures in addressing mental health issue. The remaining money will be saved as an emergency fund if there is unexpected situations in handling the program. For the outcome of these programs is by implementing this mental health awareness program, people will gain the knowledge of mental health awareness, and people will show respect and do acceptance to the individual with mental health problem and help them. This will be able to overcome their illness. If the public see individual with mental health as individual who only have emotional problems and not as illness, it can make the biggest difference for someone struggling with their mental health. This will remove the fear of being considered crazy by those around them. The public need to ensure that this individual have the same right and opportunity as other individuals. Learning more about the mental health allows one to provide useful support to those affected in the family and community. Okay, the next program is School Healthy Mind programs. To ensure the mental health of the young people is always the good conditions, the Ministry of Health in Malaysia took the initiative to implement School Healthy Mind programs. The School Healthy Mind programs is to restore the emotions of students that affected of the COVID-19 pandemic outbreaks or crises and problems that occurs. The programs use the theme of Healthy Mind awakens emotions proper living to raise awareness of school children on the importance of mental health care. These Healthy Mind programs will be implemented in collaboration with the Malaysian Ministry of Education in 2,440 secondary school and 7,718 primary school students, and this make a total of 4,779,270 students who will participate in the School Healthy Mind programs. Is in line with the attendance of school students on a rotating basis. The Healthy Mind program will be implemented through two methods, which is face-to-face and online. Among the face-to-face activity are DASS screening to identify the level of mental health of school children and any other like explorations competitions, while the other activities that will be done online are like the video competitions and online talk about mental health. 40 million has been allocated to release these School Healthy Mind programs. From the total allocations, a total of 2,900 is given to each school, and this allocation is given to the school to cover costs such as to invite the special guests of psychologists, any activities and the competitions, Healthy Mind explorations, and public speaking on the mental health that will be organized during the Healthy Mind programs. The remaining money will be saved as an emergency fund if there is unexpected situations in handling the programs. So for the outcome of this program, by implementing this School Healthy Mind program, a student will gain information and knowledge about the early symptoms that affect their minds because of the pandemic or crisis that occur, and students are able to deal with mental health problems and practice guidance interventions as a guide that can improve their mental and emotions well-being. Okay, next, the competitions type program is also designed to involve the participants of the students so that the materials produced in the competitions can be used for peer assistance and peer interventions. Hopefully, the activities arranged can address mental health and maintain the mental and emotional well-being of the people.
The first strategy for business resilience is recovery of targeted sector. Targeting a sector to be recovered is one of the strategies for business resilience. In consideration of the fact that there are many sectors who are affected by the global pandemic, which is the coronavirus outbreak, that which has crippled almost half of the business growth of some businesses in Malaysia. Also, due to the Movement Control Order (MCO) in Malaysia, a lot of business have to shut down their business. Therefore, Ministry of Health is responsible to manage the spread of coronavirus in Malaysia and the subsequent rehabilitation of some related sectors that related to it. The program to make this strategy as a success is recovery of health tourism. Health tourism is traveling from a country to another country to receive a medical treatment in specialized institution jointly with tourism programs. In Malaysia, tourism is one of the main contributors to increase the economic sector, and the private sector is one of the main attraction in the field of health tourism in the eyes of travelers. Unfortunately, Malaysia has the COVID-19 crisis that has led to step revenue drops by at least 50% in some Malaysian private hospitals, clinics and pharmacies, and numbers of patients keep dropping. So, the objective of this program is to strengthen Malaysia's rank as one of the top medical tourism destination in the region. Ministry of Health Agency, the Malaysian Healthcare Travel Council (MHTC) has targeted for an increment after the reopening of the borders in the revenue of 800 million ringgit Malaysia by the year of 2022. According to the total of the budget of 20 million ringgit Malaysia needed for this program, it consists of several spending such as 6,000 ringgit Malaysia to support beds of total 1,138 beds in 102 private hospitals in Malaysia, since these private hospitals oversee handling a few COVID-19 patients. An approximate of total cost is 7 million ringgit Malaysia for the provisions of beds in private hospitals. Next, an allocation of 7 million ringgit Malaysia for Malaysia e-visa medical to extend to the total of days, since patients only can stay in the country for periods of up to 30 days only using the Malaysia e-visa medical card. Instead of 30 days, it will be extended for 45 days, so the medical travelers can take up their time to be fully recovered in Malaysia. Last but not least, an allocation of 6 million ringgit Malaysia is to improve accommodation services in private hospitals to provide comfort to the patients. This includes accommodations such as 24 hours per 7 days room services, air condition, television and the channels which is Astro and meals facility. The outcome for this program is it can increase the tourism sector in Malaysia. Besides, with the increasement in travel sector, Minister of Tourism, Arts and Culture gets the benefits from Ministry of Health for the program of recovery of health tourism in Malaysia. Lion is by assisting for a business lion in Malaysia. An organization business continuity refers to a plan that it has in place to deal with the unforeseen circumstance so that it can continue to operate as usual. In the aftermath of the COVID-19 pandemic, many businesses had stopped operating, and because of the COVID-19 crisis, the companies have been faced with many challenges relating to the disruption of supply chains, customer demand changes, and potential risk to employee health. Therefore, a resilient businesses plan is to help to avoid such risks by simply establishing a structure that allows major operation to continue despite the worst case scenario. The program under this strategy is e-pharmacy. E-pharmacy is a medium which is website that provides service delivery of a pharmacy which brings the doctor to the patient, includes goods such as medicine and other things related to medical facilities through electronic. This website can be accessed by all generation of agents and any area, includes urban, suburban and rural areas. And the main focus of this program is for the rural areas. The objective of this program, which is e-pharmacy, it is to promote health through screen to the people during this global pandemic. many businesses cannot continue operating since the global pandemic hits Malaysia. And it is quite hard for the people to come to the pharmacy or medical center nearby because of the social distancing to stop the coronavirus from spreading. Apart from that, many pharmacies or medical center is not accessible friendly for the people, such as people in the rural area. This is because of the cost of transportation that is expensive that must be borne to go to the pharmacy or any medical center nearby. Plus, after they must pay for the transportation cost, they must pay for the medicine and medical equipment where it has doubled up the cost. Therefore, this program is to help people to reach doctor or any medical officers to consult on any health-related matters by their phone. According to the budget of 60.25 million ringgit Malaysia, these are the several estimated spending for this program, which include 20 million ringgit Malaysia to provide free broadband since 35% of the population in Malaysia, especially in rural areas, does not have steady internet services. Each rural areas must be studied with an appropriate internet coverage for the area. This broadband is for the rural area, so they can access the website easily. Next, an allocation of 250,000 ringgit Malaysia for website developer to establish this program. Last but not least, 40 million ringgit Malaysia is to provide transportation for the doctors and medical officers to reach the patient and the customers, such as ambulance and four-wheel drive to ease the access in the rural area. Lastly, the outcome of this program is everyone is accessible for health assistance, even the people in the rural area. And the outcome of this program is everyone is accessible for health assistance, even people in the rural area. Healthcare in the rural area can be geared up to helping people get better rather than just attending appointments. That's all from me. I will pass to the next presenter.
This ANMS is a new government deal that aims to make Malaysians healthy and peaceful through the culture of healthy living and environmental sustainability that supports healthy living. To make this ANMS program successful, the government must use the whole of nation approach, which involves the full involvement of government agencies, non-governmental organizations, which is NGO, and private sector. This ANMS has been designed in a period of 10 years, starting from 2021 to 2030. This ANMS program has been 4 main thrusts, 10 strategies, and 24 initiatives. This ANMS also been given emphasis in the 12th Plan Malaysia, especially improving health among Malaysian families. Facilitate the society access to health and wellness facilities and services. In terms of facilities, it can facilitate the society in obtaining medical supplies, especially to society who have a chronic disease such as kidney disease. With this initiative, the government has made it easier for the people to receive treatment, whether at home or clinic. As example, people can undergo dialysis treatment at home. With this, people can save more time, energy, and even the cost. Meanwhile, in terms of services, the government has facilitated the easy way for public get vaccine injection, which is they have provided a mobile clinic that organized by MyMedic. This mobile clinic give main focus to the residents in the PPR, and that clinic operates for 4 hours a day to go to designated areas. The budget allocation for this program is 7.5 million that divided by 2, which are 3.75 million is for them to provide medical equipment such as dialysis machines, tube dialysis, This kind of equipment cannot be shared with others patients because it is to avoid germ infections. However, other 3.75 million is to upgrade the health information system. As example, upgrading information system by using the technological systems such as storing data digitally and presenting tuberculosis (TB) laboratory test result. The outcome of this program is the rate of economic growth will continue to move as usual, because when the health of the people is granted, it can continue employment in the economic sector to increase economic income. With this existence of this program, they can get vaccine injections more faster and be able to carry out agricultural activities and become a major producer to wholesalers and retailers in the city. This shows that this vaccination program has a positive impact on rural population like this, for them to continue their life as usual even in the new norms. Cleanliness is very important to maintain the health of the people, because cleanliness is one of the factors that prevent people from any kind of disease. As an example, the toxoporosis disease known as rat urine disease, where this occurs due to the lack of hygiene awareness. This can be seen especially during the flood seasons, where the occurrence of water pollution and the probability of getting this disease is very high. Keeping the environment clean will have a positive impact on the economy, as we can see in Denmark, where their country is the third cleanest country in the world. This is because of their clean environment and attractive development. Therefore, it can attract tourists to visit their country. So, the budget allocation for this program is 7.5 million, which is 302,670 ringgit is allocated to organize 3R activities, which are recycle, reuse, and reduce. This allocation is to provide recycling bins for every district in Malaysia. However, 889,200 is used for fogging activities that carry out by the municipal council in each state, and it is a collaboration with the Ministry of Health Malaysia. This is to ensure that the chemicals used for fogging activities are approved by the MOH. The amount is used to provide fogging equipment such as fogging machines. 3 machines will be provided for each district in Malaysia. The price of a machine is about 2,500 each. 8,130 is allocated for the implementation of the Health City Showcase project, which encourage the people to live a healthy daily life. And the balance is 6 million is for the production of power plants, logic jana kuasa using high-tech system. As example, this kind of technology can be seen in Manchong, Perak. The outcome of this program is based on the activities that have been organized by the MOH, which is 3R activities. It will have a positive impact on the economy, because when these activities are carried out, our country will be more clean and environment was maintained. The waste can be recycled according to the recycling bins that have been provided, which have 3 types of bins with different colors and function, where the orange bins are for aluminiums, cans, and plastic, while the blue bins are for paper, which is a colorless paper such as magazines, newspapers, and books. However, the brown bins are for glass, such as soft drink bottles, jars, and others. Other examples such as plastic, after process, it can produce bioproducts such such as bioplastics. A clean country will also increase the economic income gap because it will attract foreign tourists to travel to our country. For example, the tourism center that make a tourist attraction is Kundasan Sabah. It will also attract foreign investors to invest in the country, such as the production of power plants, where they can expand their potential in the production of higher power plants so that it can produce more energy and effective to the economy in the future.
Okay, for strategy 2 of economic resilience is to provide more systematic management and development in the economy. This purpose of this allocation is to restore sustainable economic growth. For management and development requires allocation of 2 billion. Okay, for the first program, we have upgrading the hospital. This program created to improve the current economy in a better direction. As we know, hospital is important to us to make a checkup, get some medicine and so on. During pandemic COVID-19, of course, the area suffer from a shortage of space, equipment, perhaps only in limited quantities. These programs aims to empower target groups such as Miri Sarawak. The construction of the Miri Hospital annex building is expected to reduce hospital congestion and add to existing expertise and subspecialties. We, with this budget allocation, can use to build additional building of hospital. The management and construction of hospital preparedness can further strengthen future preparation in the face of various obstacles that has been identified. Looking at the speech of former Prime Minister Tan Sri Muhyiddin Yassin, the increase in the allocation is the government's commitment to ensure that the health system does not collapse and operates effectively. The function that we can see from this program is that rural areas are affected, especially when hospital initiative decline if daily cases also increase. Another that the additional construction of this hospital buildings is not wasted at it is for long-term use. The total allocation that have been set for management and development program is in range RM1 billion. As stated, RM1 billion will be used in terms of hospital upgrades to strengthen the public health care system. Under RM1 billion, also used for hospital construction, electricity bill, water bills, parking and bed. For the outcome of upgrades hospital, overall outcome of this program is to restore and rebuild the resilience of the country's economy to deal with any possible crisis in future. It is also called as a systematic preparation since other variants have been identified. Next is program which is drive-through pharmacy service. This program provided because there is inadequate parking at health facilities, congestion in pharmacy waiting areas and long waiting times. The benefit that we can get from this program is patients do not have to wait for their medication. We can see some hospitals that provide facilities the drive-through pharmacy service, which are Hospital Keninau Sabah, Hospital Taiping Perak, Hospital Sultanah Nuzahirah Terengganu, Hospital Sultanah Aminah Johor and others. This way can reduce the spread of COVID-19. Another that the pharmacy also provides various types of drugs that safe registered with the Ministry of Health, which this program is make easier for the public. For example, can get health checkup such as swab test for knowing the symptoms of COVID-19 virus. The parts of budget for drive-through pharmacy service is allocated Rm1 billion. Rm1 billion used to upgrade regular pharmacy to drive-through pharmacy service by using vehicles routes. Outcome of drive-through pharmacy service, we can see that this initiative is to provide convenience and comfort to the people and assist in economy. Thank you from me. For the conclusion is there are many programs that have been provided. In this budget report, we have three elements have been mentioned, which are people's well-being, economic sustainability, and business continuity. In three elements, they have their own program and have a function based on budget allocation given. Program People Well-being is more focused on effort in helping well-being of the people. For the economic resilience it aims that reduce the country's poverty rate in terms of labor, contribution, and so on. The last one is for business continuity programs is more recovery operation during disaster. Therefore, each program listed has its own initiative. It will bring towards goodness and benefits to many parties. Thank you.